Stephanie Thomas. I'm the Program Manager of Education Outreach at the Mental Health Association, and I'll let Tara introduce herself as well.
Good morning, everyone. It's great to see you all here. I am Tara Wetherell, the Social Marketing and Outreach Manager at Maryland Coalition of Families.
Thank you, Tara. So again, for those who aren't familiar, we have several campaign partners who help make the campaign possible. Behavioral Health Systems Baltimore, the Maryland Department of Health, Maryland Association of Non-Public Special Education Facilities, Maryland Behavioral Integration and Pediatric Primary Care, Maryland Department of Disabilities, Maryland State Department of Education, and the National Center for School Mental Health. They help in so many different ways, and we're thankful for all that they do. So about the campaign has been occurring in the state of Maryland for more than 20 years, and we work with so many partners, schools, organizations, and individuals who are passionate about the campaign. We are excited to have our form for champions already up and available, and we'll talk about that in just a little bit. But our goals for the campaign are as follows: to increase public awareness of children's mental health and substance use challenges, to reduce stigma surrounding mental health and substance use challenges. We're really pushing number 3 this year and moving forward to connect children and families with information, tools for prevention and support of mental health challenges. We really want to connect families one-on-one with the support that they need, and to make sure that parents and caregivers really feel connected to the system and to schools, so they have exactly what they need to support their children. To highlight creative, innovative, and impactful efforts of communities across Maryland, we'll hear from some of those today and celebrate a group that has been doing great work today. And to provide opportunities for our partners and champions to be a role model for others and make that impact across the state. So we do have some campaign updates for folks for this year. We did earlier in the fall announce that Awareness Week dates were the first week of May, with May 1st through the 7th, or May 1st through the 6th, with that Sunday being that last Sunday in April. But we have decided to align with national efforts, which shifts our week to May 7th through the 13th. So please go ahead, and if you haven't made any plans, shift your dates to the 7th and the 13th. If you have gone ahead and made plans, it is totally fine. Don't worry or fret about it. We encourage folks to do planning and activities and awareness efforts during and around Awareness Week and throughout the entire month of May. It does not have to exactly align with Awareness Week. So we encourage you to not change your plans if you've done anything already. Go ahead and keep promoting what you're doing. We will promote what you're doing on our calendar, on our social media platforms. But if you haven't made any plans, go ahead and align with these dates, May 7th through the 13th. Distribution of champion kits. We have received a lot of emails and contact and feedback on surveys about the kits that our champions have received for many, many years. And if you're not sure what we're talking about, just take a listen. So for many years, our champions have received bags or resources that they could pick up around pickup sites across the state. Moving forward, we are not going to be distributing those materials across the state. As many of you know, the prices of things have been going up, and we too have been impacted by the price of inflation. And we are grateful that many of our materials and resources are available in digital format on our website. So if you are able, you can access those on our website. And if you need help printing those materials, you can reach out to Tara and I via email one-on-one, and we can help you with printing some of those things in a limited number. But we do encourage you to print those materials, or we can help you create a resource to display at your events with a QR code so that folks can download those on their phone and have them available. So we do encourage you to distribute those things digitally and tell folks at your events and activities that they can find them on our website digitally as well. We will be talking about some other things that we hope to distribute and make available for you later on during this meeting. If you have any questions, feel free to follow up with Tara or I. More exciting, we are shifting to having more learning opportunities available for everybody this year. We had our first mental wellness social just week before last, and it was a huge success. But we have been planning some other events to spread out awareness and learning opportunities for folks throughout the year, because we all know that mental health doesn't just happen in May. Mental health challenges are happening for adults, children, throughout the entire year. So make sure you're receiving our e-news and following us on social media so you can stay on top of all of that and participate as you're able. Please make sure that if you're planning events, that you are sharing the information with us on the form that we have. Later on in the presentation, we'll have a link for you and a QR code that you can scan so you can bring it up on your phone. And you can share all the information about your events so that we can begin to measure the actual impact that you're having in your communities across the state. We want to see the impact that you're having, and we want to see the big picture across the whole state. So we're excited to see that. And if you're not, follow us on social media. All right, so I'm going to pass it over to Tara.
Thank you, Tiffany. So we're encouraging everybody here on this meeting today to take action in relation to the campaign. And of course, the first thing you can do to take action is to become a champion and register your school or organization as an official champion. And you can do that very quickly and easily through our website at childrensmentalhealthmatters.org. And once you've done that, we encourage you to take full advantage of all of the great campaign resources that we have there for you. Just tons of great stuff on there, and it gets new things added to it regularly. So it's going to continue to grow and build, and there'll be more resources, as we get closer to May. And we've got everything from fact sheets on various mental health conditions to book lists, to coloring pages for younger kids, just tons of stuff. So please do check it out on the website. We encourage everyone to please think about attending our Children's Mental Wellness Socials. As Tiffany mentioned, we had our first one last month on ADHD, and that was super informative. I know I learned a lot about ADHD. And we have one coming up in February, and that is going to be on eating disorders. So please take a moment to check that out and register for that as well. And then, of course, we need you to plan your awareness events and activities. And again, we just want to emphasize that it doesn't have to be during Awareness Week. Certainly you can do it then, but the entire month of May is Mental Health Awareness Month. So spread things out and don't necessarily feel like you have to jam it all into that 1 week. And don't forget to let us know about your activities so that we can track them, as Tiffany mentioned earlier. So just a few important dates to keep in mind. As I mentioned, our February Wellness Social is coming up on the 16th. We will be sending out information on that. Watch your email and social media for the opportunity to get more information on that and register. I think you can already register for that. Is that correct, Tiffany? Is the registration live yet?
Drop the link for that in the chat. It'll take you to our website where you can find the link to register.
Great, thank you. So then another upcoming thing that we have is the final champion meeting of the year. That will be our spring champion meeting taking place on Wednesday, March 22nd. So please join us for that as well. And just a reminder once again that the official Children's Mental Health Awareness Week is May 7th through 13th. And it does seem like it's happening a little later this year just because the month starts on a Monday, and so the official week kicks off on the first Sunday of the year. So that's why it's a little later this year. So, and just make sure to get all these updates and more, just make sure that you are signed up to receive our monthly campaign newsletter. So just to make it easy for you, we have this wonderful QR code here on the page, and you can take a picture of that and go right to the registration page and get yourself signed up as a champion right here today. And if you do that, you are connecting yourself to a vibrant network of passionate advocates who are all dedicated to raising awareness, reducing stigma, and providing rich resources to improve children's mental health and to reduce substance use in children, and to support families in their communities. And again, another reminder that once you register as a champion, you'll have all that great access to our digital resources. There's a media kit available as well. And not to mention technical assistance from myself or Tiffany. If you have questions or need some guidance on what type of activity or event might work best for your organization, we are always happy to help out. Just reach out to us and we can give you a hand.
For those of you who have been a champion for many years, you may notice that the form does look a little different this year. So everybody is using the same form. So you'll use the same form. You'll go on and you'll designate whether you are a school champion or a community champion. And school champions can sign up to 4 schools because some folks work at multiple schools. So that is a nice feature on this form this year. If you have any issues with it, please reach out to me directly. If you are a parent and you think that your child's school should participate, feel free to share this information with them. If you know a business or organization that you think should participate, feel free to do the same. Your child's pediatrician's office or anyone. We've had all different types of businesses and organizations participate. So you can share this information broadly with your community and encourage them to sign up. We had restaurants that have participated in and offered, discounts during Awareness Week for folks who've worn green. So that's a really, really fun way to help raise awareness for children's mental health and a really great idea for that week. So if you have any connections there, you can do that. Just a fun idea. So we encourage you to share this information broadly.
So as I mentioned, I'm sorry, is this yours?
I was just going to say that our resources are continually being updated. And you can scan that QR code up at the top to go directly to our resource directory. And so we are adding a lot of new categories this year for resources. So please share our resources. As we mentioned before, this is your tool this year to find what you need. And if you need printed copies, you can reach out to us to request those. And you can share this link with anybody at your events as well.
Great, thank you, Tiffany. So our mental wellness socials are an exciting new campaign component that we're doing this year. And we are doing this to provide more educational and networking opportunities to families, educators, and other community members and advocates. And for starters, we're working on a series of 6 of these running January through June. And these are a unique opportunity in that you will hear from an expert guest speaker about a mental health topic. And then there will be breakout rooms based on subtopics around the main topic in which you can engage in conversation and share resources and network with other children's mental health advocates throughout the state of Maryland. And it's a great opportunity to share ideas and resources and even get support from other professionals who may be attending as well. And so our next one is coming up on February 16th, and the topic is going to be eating disorders. We have two great speakers coming from the Center for Eating Disorders at Sheppard Pratt. So we have another great learning opportunity available for anyone who is interested. We have a free youth mental health first aid opportunity coming up on Thursday, May the 4th. So right before the official kickoff of Awareness Week. And this is being offered through the Mental Health Association of Maryland. And there are going to be other dates available as well. So if that date doesn't work for you, but you are interested in taking youth mental health first aid, which we encourage everybody to do, just email the address you see here on the screen and find out about the other date opportunities.
I want to answer a question that came in the chat box out loud about the First Lady's art program. So as everyone knows, we have new administration in the office. We are in the planning mode to do some type of activity with the governor and the First Lady. It will likely not be an art program as there has been for the last 8 years. Art was Mrs. Hogan's passion, and we celebrated that with her for 8 years, and we're very lucky and fortunate to do that with her. But we are in the beginning stages of planning some activities with the new administration and are hoping to do something in May and also do something later again in the fall. So stay tuned. That's all in planning mode. So I would like to introduce Julie. Julie, please forgive me. I am going to not say your last name correctly at all. So I'm going to go ahead and just let you introduce yourself.
Oh my gosh, too funny. Yes, last name is Slivka. I know that.
Slivka, that's what I was going to say.
No worries. Excellent. Well, I'm just going to go ahead and share my screen real quick. From beginning. Okay. Alrighty. And just make sure that you guys can see this all right. Okay, great. So hello, everybody. Good afternoon. Happy Tuesday. My name is Julie Slivka. I am with the University of Maryland Extension with the Maryland ROPTA program. You might actually know us from our former name before we got some new grant funding. We're able to expand a little bit, but Maryland ROPTA, you know, we love our acronyms in this sector. So that stands for Reinforcing Overdose Prevention Through Training and Advocacy. And I wanted to give you an abbreviated version of our program offerings today. We do have quite a bit, but I really wanted to focus it in on two programs in particular, our BOTFIN program, Life Skills program, as well as our This Is Not About Drugs, because these are two programs that I think would be of most interest to those of you who are working in schools or after school programs or anything that is youth facing. So a little bit of background on ROPTA. What we are doing is, again, we are kind of initiative in the University of Maryland Extension program. We work to enhance the capacity of rural communities in Maryland to identify, understand, and respond to the opioid misuse epidemic. And we're actually expanding that to all drugs, all alcohol, most substances, that kind of thing. So we do this through kind of a three-pronged approach. We deliver evidence-based trainings. We offer no-cost train-the-trainer opportunities. We also are working very hard. We have a very impressive group on our team here, a lot of doctors who are working very hard with interns and other graduate students and PhD students to create some publications and articles, and we'll go over what we have had published recently. But we're doing this to disseminate information and really help break down the stigma and bolster community understanding around behavioral health and substance misuse. And so we're really just working, one of our biggest focuses this year especially is working to harness the power of youth and those who serve youth to really make sure that we are preventing substance misuse from kind of the ground age up. So a little bit about us. So I tried to break down, we have a plethora of training. So I tried to break it down into like 4 program areas. We have mental health first aid, we offer youth and adult, and we also are able to offer 1 or 2 times a year in partnership with the Mental Health Association of Maryland instructor training. So that's really cool. That's at no cost. BOTFN life skills, we'll go over that a little bit, but we have done middle school and high school direct service delivery in the past, but currently we're focusing on enhancing the ability of communities to offer the BOTFN life skills training in a direct fashion, empowering them to offer it directly as opposed to us offering it. Then we have We're Grounding Our Response. This is an awesome training series that was developed by Maryland Department of Health, and that includes Drug User Health Framework, Adverse Childhood Experiences or ACEs, Social Determinants of Health, MAT as overdose prevention. MAT, if you don't know, is medication assisted treatment, and stages of change. So those are 5 presentations that we offer. We have a lot of organizations that do those, some of them one-off, some of them as a series. They'll do it monthly. We're actually currently offering that series with Worcester County Health Department, and they're able to, through a partner organization of their own, able to offer some CEU trainings. And all of this can be found on our website if you're interested. And then finally, we have the Overdose Lifeline series, and in that includes presentations such as The Brain and the Disease of Addiction, Guide to Harm Reduction, Opioid Public Health Crisis, Generation RX, and This Is Not About Drugs. In that last one, we'll go over a little bit more in depth. Okay, so first and foremost, I don't know if you guys wanted to put in the chat, have you guys heard of BOTFN life skills training? I would love to know if any of you are familiar with it. Those of you who are not, BOTFN Life Skills Training is an amazing program. It's been 30 years in the making. It's a dynamic, activity-based and evidence-based substance use and violence prevention program that is uniquely designed to be flexible and interactive for youth. It is actually recognized. Oh, good. You're Googling it. Google knows everything. BOTFN Life Skills Training is actually recognized as a model of exemplary program by the U.S. Department of Education and the Center for Substance Abuse Prevention. It's actually backed by over 30 scientific studies, and currently they just released their most recent data reports, and it's been proven to reduce tobacco use by 87%, drug use by 75%, alcohol use by 60%, and violence, interpersonal violence, bullying, that kind of thing, by about 50% in youth and young adults. So it's a very successful program that has loads of scientific research behind it and corroborative evidence. So a little bit more about BOTFN Life Skills. Again, more of this can be found on our website or at the BOTFN Life Skills website, but really what it is it focuses on social emotional learning and development, helping youth develop a greater sense of self-esteem and self-confidence, and in that the ability to be assertive when rejecting peer pressure and social influences to partake in drugs and alcohol. It really focuses on effective coping mechanisms to deal with life's anxieties and stresses. And it focuses a lot on biochemical feedback and the immediate, midterm, and long-range consequences of substance use, especially on the developing brain, which we know is continuing to develop until 26. So that really early intervention upstream approach is so crucial. And again, it really focuses on cognitive and behavioral competency to reduce and prevent a variety of risk behaviors. It really focuses on empowering youth, and it does it in a very activity-based approach. It's very fun. It's very interactive. I've personally taught it virtually. We started it in 2020, which we all know what happened then. But it is also very effective as an in-person training program. So the audiences, they do have it for middle school and high school. Currently, ROPTA is really focusing on the middle school level, which is the program level 1, grades 6 and 7. It's very flexible. It's very adaptable. So it can be anywhere from 12 to 15 to 18 sessions. we recommend, from our own experience, offering it in 45 to 60-minute increments, 2 to 3 times a week, or really whenever you can fit it in and make sure that you're able to complete the full duration of the training. It is ideal for schools. We have done it in health classes, after school programs, faith-based programs, and mentorship programs. And I won't go into this video, but there is some really great empirical evidence. And I will, Tiffany, I'll send you this PDF so everyone can go in and look at these videos if they're interested. But there's a lot of evidence out there and testimonials about the efficacy of this program. So again, foundation level 1 is ideally implemented in grade 6 and 7. There's a couple that are optional lessons, a lot of the violence prevention programs. And we do recommend that it's done about 2 to 3 times a week or until the program is complete. And one more time, Maryland ROPTA, what we're doing currently is we're covering the cost of the instructor training. So kind of a train the trainer type opportunity. And we will also cover the teaching manual and the students' guides and workbooks, and we can offer some TA technical assistance. So a brief teaser on the Botman curriculum and how the lesson plan is kind of laid out. We have the self-image and self-improvement, kind of builds on that, goes into smoking, biofeedback, alcohol myths and realities, marijuana myths and realities, the effects, the profound effects of marketing and advertising, and really how we know a lot of these big pharma and tobacco and alcohol companies are really working to target youth through various means. We talk about violence in the media, and then we really go into a lot of practical life skills like coping with anxiety and coping with anger. We talk about communication skills, verbal and nonverbal, assertiveness, social skills, and conflict resolution. So it's a very comprehensive, all-encompassing program, and it really is an amazing program. And the cool thing about it is, while there are fidelity standards, you're really able to incorporate any, activities or videos or anything that is relevant, maybe more to your community or the culture or this, who you're working with, to really make it interactive and accessible and relevant to the youth that you're serving. So, just to reiterate, it works on personal self-management, general social skills, and resistance skills. And we know that there is a lot of evidence that shows that it is really effective at reducing the tobacco, alcohol, illicit drugs, and as well as decreasing bullying, fighting, and conflicts in schools. So we ROPTA actually back in 2020, and 2022. I think that's wrong. This is the report we submitted, but it is from 2020. We had some really great data that really demonstrated how effective this was. We did see significant decreases in, drinking attitudes, as well as anti-smoking, anti-drug, and an increase in self-control, anxiety, coping mechanism skills, assertiveness skills, and drug refusal skills. And if you wanted to, we actually were just featured in the National Extension Association of Family and Consumer Sciences, and it is on the feasibility study of our virtual pilot program, again, of our 2020 pilot that we did out in Western Maryland. So if you're interested in learning a little bit more about this, please feel free to contact us. I'll have our contact information at the end. You can learn a little bit more about the program online. The program is self-paced, the training, and it takes about 6 hours to complete. And it's a really great program, and it's very cost effective because it is free. Thank you. Also on our YouTube channel, there's some quick FAQ that you can look at to get a couple of those questions answered. And real quick, let me just touch on, this is not about drugs. If you wanted to put in the chat, have you heard about it, TINAD? It is through, or Overdose Lifeline, which is the organization that it's through. So TINAD, this is not about drugs, is a prescription pain medication prevention education program. And it's actually one of the first universal youth-focused education programs that is really based on peer-to-peer, real-life personal stories. And it is actually a very good complement to the Botfin Life Skills program. So it really hones in on, the risks of prescription pain misuse, how it can lead to addiction, recognizing the overdose symptoms, how to call 911. We talk a little bit about Maryland's Good Samaritan law, and we talk a lot about, alternatives to stress management and how to seek help if you or someone else that you know of is dealing with possibly a drug dependence. Again, it takes that peer-to-peer approach. It makes use of personal stories to educate and influence. And it really just talks about, it's not about drugs, it's about your choice. It's about your choice and what you choose to do with your body, and what you choose to do with your life. So there is a film and discussion in it. It is evidence-based, so there's pre and post exam, and there's a lot of interactivity in it. And there's Overdose Lifeline is great on having a wealth of resources on their website that really can continue that conversation through resources and interactivity post training. And the great thing about TINAD as opposed to Botfin is it's kind of a one and done. Even though it opens the door to continued conversation, it really is just a 1 hour opportunity to really dive into this. And sometimes that's a way to test the waters with your students. There is a complimentary program for parents and guardians and other youth people who work with youth. But it's a really great dialogue. There's a lot of more, again, evidence that prove that it is a very effective program, but through increasing, youth knowledge about the dangers of substance misuse and, how to get help and what can be done to prevent, risky behaviors in life. And I will drop all of this information in the chat, but this is, again, just a little overview of our 4 program areas. And, in our 3 years of being ROPTA, we have had almost 9,000 course participants. We've trained 900 mental health first aiders. We've had over 118 community partners. MCF and Children's Mental Health Matters have been amazing community partners. We're very eager to partner with you guys again for Children Mental Health Matters, both the month of May, but also, before, after, during, beyond. And we would love to partner with any of you guys. Again, all of our programs are no cost. So please definitely feel free to reach out to us to learn more. I'll drop some of our information in the chat, but as always, feel free to stalk us on social media. We've got, we're on Facebook, we're on Instagram, we're on YouTube, and then we have a monthly newsletter that allows you to be the first to know when we are starting to offer those no-cost programming. So while we do offer programs to the community at large, we also love to offer private programs with our organizations. We work with schools, we work with departments of social services, health departments, and all of that. So please feel free to reach out to us. Don't be shy. We'd love to work with you. We love to support what all of our incredible partners are doing out there. We are here to support you the best that we can. And if we can't, maybe we can refer you to someone else, but we are thrilled to be here. Thank you, Tiffany. Thank you, Tara, for allowing ROPTA to be here today. And thank you all for what you do.
Thanks so much, Julie. So if anyone has any questions for Julie, you all can reach out to her. Julie, if you don't mind, to put your email address in the chat, that would be great. So we're going to transition now. We have 2 polls that we would like to launch for everyone here. I'm going to launch the first one. There on the first poll, it's a multiple choice question. We would like you to choose your top 2 answers and no more than that. Couldn't limit your number of choices that you could choose, so please just choose your top 2. The question is, as a champion, what type of Children's Mental Health Matters branded item would you prefer to have? There is a clear winner. Tara, can you see these results too?
Yes, I can. I think we have some clear winners here.
T-shirts for the win. Awesome. Thank you everybody for your feedback. All right, I'm going to end that poll. Thank you so much. Share the results just so everybody can see what everyone said. Okay, I have one more question for you. Would you be willing to donate or collect donations as a champion for the campaign?
Tiffany, can you elaborate a little bit on that and explain more what you mean by that in regards to like donating items for the
Sure.
campaign?
We're talking monetary donations. So if you were unsure about that, you can mark it. We've had quite a few folks reach out to us and say, hey, would you be interested in taking donations? And we've never taken monetary donations in mass before. And so we just wanted to do a poll and see, how many folks would be interested in doing that. Sometimes it's school groups that want to do a donation, or, teenagers that want to do, a campaign of sorts to raise money for the campaign, or even, community groups as well. So this is something we're exploring and we're, open to. So we're really just exploring that option. I know that's not a super great answer, Corey, but just know
Oh, that was good. I just needed a little bit of clarification. So thank you.
You're welcome. All right, thank you, everybody. All right, so I'm going to take a minute here and we're going to celebrate the hard work of one of our fantastic champions. So there's a group in Prince George's County. They call themselves the Prince George's County Mental Health Champions. There's a lot of people in this group. There are some of them on this call. This group, this is their 10-year anniversary, 2023. And they promote children's mental health across the entire county. They represent a lot of community organizations and nonprofits and mental health services and even some schools. And they do such incredible work in Prince George's County every year. And I am so thankful for each person that represents this group and all the organizations. They have their own Facebook page. And last year they did some really fun things. And I'm really excited because some of the representatives are here today, and we're going to break out into breakout rooms, and they are going to go into a breakout room and you can hear about their success, about some of the events that they've planned and activities they've planned for communities in Prince George's County. So if you're here today and you would like to hear about their success and maybe, borrow some ideas from them, you can do that. Or you can go into a breakout room and share your ideas or brainstorm some of your own ideas that you have as well. So we're going to offer 2 breakout rooms for you for the rest of this meeting time. You do